The member for McKellar has the call.
Mr. Speaker, my question is to the Minister for Health. Will the minister outline to the House how a stronger economy enables the government to deliver record investment in world-leading medical research that will develop life-saving medical breakthroughs and create tens of thousands of jobs?
The Minister for Health.
Thank you very much, Mr. Speaker, and I want to thank the member for McKellar, who's been a great advocate for the biomedical sector and the pharmaceutical sector, which has a very significant base within his electorate. One of the things that he has often pointed out is that you can only deliver life-saving medicines, you can only deliver growth in hospitals funding, growth in Medicare funding, growth in mental health funding, if you have a strong economy, if you have the basis for a stable economy which will deliver better results for those in work and better results so as the government can ensure proper investment. Now, as part of that, what we have seen is that this government has been able to secure Medicare and hospital funding, mental health funding and the PBS, as we discussed yesterday, with the investment in Spinraza and the comparison with those who came before us who denied access to fundamental medicines. But what we did last night, we didn't just invest in life-saving medicines, but we invested in a new medical industry in Australia. As part of a $6 billion medical research funding package over the coming 4 years, there was at the heart a $1.3 billion medical and health sector industry growth plan. That included $240 million for new frontier science research, $248 million for rare cancers and rare diseases clinical trials. This will give access to new medicines to those who could never have otherwise have had that possibility. But at the heart of this new hub, this new funding plan, is a $500 million 10-year national genomics plan. That's about delivering precision medicine to 200,000 Australians and more. It's about giving them access to genetic testing. It's about building the research capability and making Australia a global destination for the new wave of medical treatment, medical research and all of the jobs which come with it. So the two things that we want to create: better health outcomes for over 200,000 Australians, and over, on the best estimates we have, 200 new companies to be created and tens of thousands of jobs come together in this one initiative. The first step we will take, though, as part of this, was outlined by the Treasurer today. It will be the creation of Mackenzie's mission, and this is a $20 million plan to help 10,000 families access preconception genetic testing and screening for conditions such as cystic fibrosis, SMA and Fragile X. It means that fewer children are likely to be born with these conditions in the future. That is the outcome of a budget built on a strong economy.